It's time for a Senior Citizens Forum. I'm Janice Wood, your host, and the Senior Citizens Forum is being sponsored by Benefits for You Too Insurance Services, where they provide Medicare supplement, Medicare Advantage plans, and Medicare prescription drug plans for people that are 65 years of age and older, and for people younger than 65 that have certain qualifying disabilities. And today we are going to talk about Medicare. What is Medicare? What is a Medicare Advantage plan? What is a Medicare supplement plan? What is a prescription drug plan? And who qualifies? How old do you have to be? And are all these plans rated? And what are the changes that are going to be taking place for 2025? And we're also going to go touch on the different types of election periods. So today I have with me on the show Devin Thorpe, who is a co-host, like I am, on E360 TV. So welcome, Devin.
It's a pleasure to be here with you.
Yes. And Devin has a resume that is long. He's done so many different things, including politics. And Devin, what is the name of your show, real quick?
Superpowers for Good show.
Right. And I know he's on E360 TV. He's one of the more popular hosts. So thank you for attending this morning. And I also have Dean White from Caring Seniors Living. Dean has been on my show before. Dean is not of Medicare age, but he works with a lot of seniors, and I meet with him in a business meeting every once a week, and he's always saying, you got to talk to Janice about Medicare. Okay. And he wants to know more about Medicare. So maybe he'll have more information for his understanding what his clients are going through. So welcome, both of you.
Thank you.
We're going to be going through a presentation that I have. And, if you have some questions, if you could hold them until I finish each section, I would appreciate it. Okay. So we can get through this in a timely manner. Okay? So up here on my screen, it says, who is eligible for Medicare? And so you either be age 65 years of age or older, or under the age of 65 receiving Social Security Disability Insurance, that's SSI. And sometimes that where it says Social Security Disability Insurance, it all could be called Social Security Supplemental Insurance. You have to have payments for 24 months of it. And on the 25th month, you then qualify for Medicare. If you have ALS, and it has a really long name, also end-stage renal disease, which is kidney disease, and you go on dialysis, you then qualify for Medicare at no matter what age. And that's usually, I know with the end-stage renal disease, that's 4 months after you've been put on dialysis. If you want to be a residency in the United States, you have to be a U.S. citizen or a permanent resident for 5 consecutive years. And there's a lot more that goes into that, but we don't have time to go into all of that today. Okay. So we touched a little bit on some of this already. If you're already collecting Social Security from that SSDI, you will automatically 3 months before your birthday month, you will receive a card in the mail. If not, you have to sign up to join. And over here is the different ways, the 3 different ways that you can do it. I always recommend, if you're going to apply at the Social Security office, to sign up for an appointment, okay? Or you can also call them on the phone and talk to them. But these are the 3 different ways to show up for Social Security. So do you have any questions, guys?
Yeah, yeah. Seems to me that there's a big difference between SSI and SSDI. That SSDI is for people with disabilities, and SSI oftentimes includes people that aren't traditionally disabled but have no income. How do you qualify for SSI? And when after you qualify for SSI, do you get Medicare?
Okay, and I'm going to answer that a little later on in more detail. But SSI are for people who have paid in their 40 quarters into Social Security.
That's
And
SSDI.
SSDI, you have to either have some kind of physical thing, and I can
Right.
talk to you about that in more detail, because I can talk an hour about that too. Okay.
Okay.
So there's a lot to it, but usually people that have SSDI are under the age of 65, and they don't have those 40 quarters at that time.
That's SSI.
But if you have SSDI, you have those 40 quarters.
Yes.
Okay, because
Yeah,
we
you have to
also
have it. You have to have worked to get SSDI, but you don't have to have worked to get SSI.
right.
And
DI,
then
SSDI,
Medi-Cal is a whole nother bucket, correct?
right. It's SSDI. You don't have had to have worked.
I
SS
think you got that backwards, Janice.
got it reversed. Okay.
Yeah, you got it reversed there. Sorry.
Okay.
SSDI requires 40 quarters and SSI doesn't, I think.
SSDI does not. Okay. And
It
it's completely, it's different, totally. But I said I can go into another hour just for that. Okay. All right. So on here, you see that I'm talking about original Medicare. So what is original Medicare? It's broken down into 2 parts. It's part A, which is the hospital insurance. And I'm going to go into that in a little bit more detail. Part B is almost everything else. So when you sign up through Social Security for Medicare and you get the red, white, and blue card that comes in the mail, it has a bunch of funny numbers on it. That is going to show you Part A and Part B and when those went into effect. Now, I represent private insurance companies. I do not represent the Center for Medicare and Medicaid Services, better known as Medicare, okay? I represent private insurance companies, and I am a broker, okay? So when you see your commercials and they're talking about Medicare supplement, I can provide you that. If they're talking about prescription drugs, I can provide you that. And when you hear them talk about Medicare Advantage or Part C plans, I provide that. Okay. All right. So Part A, as I said, is the hospitalization. It provides inpatient hospital care. And I really believe in people knowing what their benefits are, a strong believer in that. So you want to be careful with your insurance if you're outpatient or inpatient, because you're going to be charged differently. Okay. It's your skilled nursing facility, or it can be what some people call it convalescent hospitals, okay, or rehab hospitals. Hospice care is part of Part A. and limited home health care. And I know Dean is familiar with that, okay? All right. Part A, if you paid into your 40 quarters through Social Security, which I recommend that everybody do, okay? All right. There is no cost to Part A. So, I mean, I can give you an example of people who don't have Part A. Maybe some governmental workers or school teachers don't pay into Part A. So it's important that you pay into Part A. If you don't pay into Part A and you have less than 40 quarters and you paid at least 30 quarters, you see what your cost is going to be on a monthly basis. If you have less than 30 quarters, now you see what the cost is right here, that $505. Now, in all the years I've been doing this, and this is like going on over 17 years, I have one client that pays this on a monthly basis, and it doesn't go away because they did not pay into Social Security. Original part of Medicare Part B is your doctor's visits. It's your outpatient surgeries. It's your diagnostic surgeries. It's your emergency room care and your durable medical equipment. So when we're talking about doctor's visits, so that can be your primary care doctor, or that can be your specialist, will fall underneath there. Outpatient surgeries, I can tell you from experience, I've had 2 surgeries that I thought would be inpatient lately, and they call it outpatient surgery. So when you go in to the hospital, I always recommend you ask, is this going to be outpatient or is this going to be inpatient? So you know what you're going to be charged. Diagnostic screenings, that's going to be like your cancer screenings are going to come under that. A lot of them, not all, but the majority of them. Emergency room care will definitely come underneath that, but with a lot of plans, that emergency room care could be waived, but under original Medicare, it's going to get charged. And durable medical equipment is like, you know, those wheelchairs, the oxygen. I know, again, Dean's familiar with this, the beds, all these different things that people may need. Now, if you sign up, and I work with this all the time. If you sign up, you're still working and you're over the age of 65. When you turn 65, you should at least be picking up Part A, especially if you paid those 40 quarters. And if you're still working, that means that you're getting your health insurance, your credible health insurance through your employer, okay? You do not have to pick up Part B right away. Now, if you're not working and you're turning 65, I recommend you definitely pick up Part B right away because it does have a penalty. And you see what those figures are right there on the penalty. So I like to work with people. Now, I have had people, I think maybe one time I've come across somebody who's gotten a Part B penalty. So it's very rare. But I do recommend that you talk to someone before you sign, when you sign up, to find out if you should be signing up for Part B. Definitely if you're not working, but if you are working, but some people will move over to Medicare anyway, because it may be better than what is being provided by their employer. Okay. Original Medicare doesn't cover everything. And the majority of what it covers that it doesn't cover is the deductibles. It's not going to cover the co-pays, and it's not going to cover the co-insurances. So what's a copay? A copay is a flat fee. A coinsurance is a percentage of something. I know I'd rather see a copay versus a percentage of something. It doesn't cover your outpatient prescription drugs. It doesn't cover healthcare outside of the United States. A lot of people don't realize with Medicare, it's only covered within the United States and its territories. Once you go into Canada or into Mexico, you're not covered. But if you can go into Canada and then go into Alaska, you are covered. Okay. Routine eye exams and most glasses and hearing aids and the screenings for those are not covered by original Medicare. You guys have any questions?
I'm sure we'll get to all the
All right.
things that I have questions about.
Okay. So what is a Medicare supplemental plan? I know you see that the advertising for it all the time. It covers the gap that Medicare doesn't cover. So a lot of people will pick up a supplemental plan. It will cover those deductibles. It will cover the co-pays and the co-insurance. It will cover the freedom to choose a Medicare appointed doctor, of course, in the United States. They have all these different letters that go with it, like what's real popular in the California letter would be GFNC, and depending upon when you turn 65, which letters do you use? But there are other letters than that if you are from some other part of the United States that you can use. And it does have a monthly cost that varies according to your county and your zip code and your age. And the premium does go up. I've seen the premiums go down once in the last 17 years, but most of the times I see those premiums, they do go up. Medicare supplemental plans, when they first started, way back when, okay, the prescription drug plans were embedded in them. They're no longer embedded in them. The drug coverage will need to be separate. And there is the drug plans or other credible coverage. So again, when they're talking about other coverable coverage, that means that you have a coverage from somewhere else, which is usually an employer, or maybe your spouse is carrying you under their coverage. That is considered credible coverage. But it has to meet a certain standard by the Center for Medicare and Medicaid, which is CMS. Okay. Part D, okay? This is where we're going to see for 2025, we're going to be seeing changes in Part D. So in the 17 years I've been doing this, I always see different changes come about, but nothing as dramatic as this is going to be for this coming year. There's actually going to start to see some restructuring, which is going to be very interesting to see how this works over the next several years, okay? So you need to pick up some prescription drug costs get covered. They come in two different ways. You can, if you have a supplement, I definitely recommend that you pick up a prescription drug plan, okay? And that will have a cost, or you can get it as it's integrated into a Medicare Advantage plan. And with the prescription drug plans, you have to live within the plan service area. So that means I know the three of us on this video right now live in three completely different service areas, okay? So Dean lives up in the Central Valley of California, which is in the middle of California, more of the farm area. Dean lives in Orange County, and I live in LA County. So our service areas are completely different. Part D has a late enrollment period. And I have worked with this many times over my 17 years. I will have people that I will meet will say, well, nobody told me about the Part D late penalty. And they'll have, let's say, a Medicare Advantage plan, what I'm going to explain in a little while. Or they will say, well, when I turned 65, I was really healthy and I wasn't taking any medication. I didn't think I needed it, okay? And they will opt out of it. Well, what happens is 63 days after you qualify for A and B and you don't pick it up, you're going to get a penalty. And that penalty is 1% of the national base premium multiplied by the number of uncovered months. And that multiplier right here changes on an annual basis, and it does not go away if you get it. I think right now I have 6 clients on that, and I have to figure that penalty out every single time. So I am totally familiar with this. Changes are coming to Part D, like I talked about before. The Inflation Reduction Act, or known as IRA, which was passed in 2022, increases the access to treatment and expands drug coverage, provides affordability by lowering Medicare costs, limiting price increases, and it makes Medicare programs more sustainable now and in the long run. I'm not even going to go into all of that, but that is like the government explanation. So over here in 2023, I'm not going to go over all of this in real detail. You're going to see where the changes started taking place, where vaccines had no co-pays and insulins, which was a big one for a lot of my clients, became $35 a month. Then there's something called extra help, which is for people that are lower income, not on Medicaid or Medi-Cal, which are both the same thing, but they can qualify from extra help. And then I'm going to talk about this briefly, what the elimination period is for 5%. For 2025, your maximum out-of-pocket annual cap is going to be $2,000. The monthly payment program for yearly out-of-pocket prescription drugs. So that means that this is really going to help people at the beginning of the year if they're on very expensive drugs to pay it out over the 12 months, okay? Part D was broken into different stages, and stage 3 was eliminated, and it was called the coverage gap. And some people may know that as the donut hole. It is going away. Okay. And then I like this, the implementation of manufacturer discount programs. Okay. That is going to be put into effect. Now I'm going to go over this is more. It says your out-of-pocket prescription drug cost is capped at $2,000 a year. So once you reach that $2,000, and that's how much you pay, not what the insurance company pays now, it's straight what you pay, okay? You can enroll into Medicare prescription drug payment plan by spreading it out over a 12-month period. Now, one of the things in the classes that I've been attending for this is if you decide to change plans, that's not going to go away. You're still going to owe the plan that you're leaving that money. You're going to have to pay it. So they built that into the system. And this is what it looks like now. I'm not going to go over this in detail. if you guys have any questions with it, but this is what it looks like for 2024 now. It shows the 4 stages, and the stage 3 is going away. So do you have any questions here? Because this is new.
Yeah, I wonder why stage 3 is going away.
Well, stage 3 is going away because when you got into stage 3, how it works right now, once you and the plan together spent $5,030, okay, you went into stage 3 where you had to pay 25% of your prescription drugs. So may it be generic or brand name, you pay 25%. So I know I have several clients and even some personal relative that take some very expensive drugs monthly. And they would once they spent $8,000, then they went into stage 4. So they eliminated this and put the cap at $2,000. Does that help you out, Dean? It's starting to make things more affordable.
Got it. Thank you.
Okay, no, I like the question. It's a good question, especially if you're familiar with Medicare, you know all of this stuff, or hoping, but it's been very confusing. As I said, I met with some people yesterday that were so upset with all of this. All of a sudden, because they didn't understand the stages, they went to the pharmacy, they went to pick up their drugs, and they like were paying maybe $0 for them. And all of a sudden they were like $200. And they don't understand it. So this is like hope to be going away with this, some of this confusion. So again, this describes some of this again. And over on the very where it says phase 3, where they say MOOT, that stands for maximum out of pocket. So that's the maximum out of pocket that you would have to pay. All right. So if you have any questions, I love you guys to ask them at this point, because these are where the changes are coming in. This is also where we're going to see the coverage gap phase. Here it says it goes away on December 31st. And this is going to be replaced with what they're calling the manufacturer discount program, hoping that this is going to lower the cost of some of the drugs for some people.
My questions are going to be more on somebody who has never signed up for Medicare before and just getting started. What do they do they just call you? Is there forms? Do they need a
I'm going to get to that in the very end.
Perfect. Okay, perfect.
Right. Okay. So thank you. It's a good question, and I'm going to remember to answer it. Okay. All right. And this is just more about the same thing, where it talks about the changes going on, where it says participating manufacturer must make an agreement with CMS, that's the Center for Medicare and Medicaid Services, for their coverage, and where the discounts must apply for brand name drugs. But I would think, Dean, for some of your clients, maybe this is going to help them pay for some of those prescription drugs, looking into the manufacturer discounts. Okay. And this is just more about the same thing. Do you guys have any more questions?
Well, there's an important aspect to signing up for Medicare that I think we need to talk about, Janice, and that is that there is one window when it's optimum to get your Medicare with Medicaid, the Medigap or supplemental insurance instead of a Part C plan.
Okay, I'm
And
going
that
to
is
go over
when
that.
you turn 65.
Okay, I'm going to go over all that, but I'm giving you the
Okay.
basics so you know what I'm talking about when I get there. And I'm talking about the changes right now, okay? So what is available for upcoming? This is just more of everything that I've talked about with the out-of-pocket is. And let me go to more of what you're interested in. And this is just more to what to watch out for in the changes. So I'm hoping if people are in Medicare that they're watching the changes that are going on, they definitely can feel free to contact me, or if they already have an agent, please contact them so they can explain to you exactly what's going on with these Part D changes, okay? And this is just more detail on this. So you see how important they feel that is that you understand it. So when I meet with a client, one of the things I do is I go over all their medications. So I do not talk to anybody without reviewing their medications. I have clients that are on a standalone prescription drug plan, or they have it integrated in their Medicare Advantage plan. And this talks about if it doesn't matter if you what health insurance you have, Medicare, or you have group insurance through employers or unions, or you have standalone health insurance. Every year you're going to get a notice of changes of what is going on with your health insurance for 2025. And again, I am a strong believer that everybody should know what their benefits are. This is more information on what extra help is if you don't qualify for Medicaid. In California, it's called Medi-Cal. A lot of the different states will call it something different, but most states call it Medicaid, but here in California, we call it Medi-Cal. And this is how you qualify for the different help. So, you may know someone who needs that help. Again, I met with some people yesterday and I went over with them if they qualified, and they did not qualify for it. And one of the people that I met with yesterday was already on Medicaid. So that was good. And their needs are all different. So what is the Medicare Advantage plan? And I know you're hearing a lot about Medicare Advantage plans right now. I see a lot of the different carriers, and I represent a good many of them, are doing a lot of advertising right now because we're going into the annual election period time, which I'm going to go over those periods in a few minutes, okay? So a Medicare Advantage plan covers Part A and B. It also most plans can have prescription drug plans embedded in it. They can't offer you anything less that original Medicare offers you, but they can cover those things that Medicare doesn't cover. So if you remembered earlier, it doesn't cover those glasses, it doesn't cover those hearing aids, and they cover a lot more. Okay, let me go here. Then they have IRMA, what they call IRMA. This is the cost of what Part B and D can be. And if you have a Part B original Medicare, and you make where it says right here, single or joint, these are the figures that you're paying on a monthly basis. These are going up for 2005. There's going to be an increase to Social Security at 2.5%, and the Medicare is going to be going up higher than that. So it's going to be over $200. Those exact figures haven't come out yet, but this is what I have been reading. If you make over these amounts of money, this is what you pay. I do have clients that pay these higher figures because they make over this amount of money. But the majority of my people are paying this. You also see for Part D that there's a cost more now it's showing that this is not applicable. There are some costs for the Part D. That will go up according to what your costs are. So usually if you're on a prescription drug plan, this is where you're going to really feel this. If you're on a Medicare Advantage plan, depending upon the area you live in, you're not going to feel this as much, but you will see these charges if you're making more, if your income is at a higher level. Here are these enrollment periods. So I'm going to go over these. You both asked me indirectly almost the same question. The initial enrollment period, that is when you are turning age 65. It is a 7-month window, and the initials for it is IEP, okay? And it's 3 months before your birthday month, and it's 3 months after your birthday month. You sign up for Medicare. I always advise people to do it 3 months before. That way you know what you're going to be able to sign up for. Your Medicare Advantage plans also fall in this window. Your supplemental plans are different. It's 6 months. You have a 6 months window from your birthday month to 6 months out, okay? The annual election period, which is going to start October 15th, and it's going to go to December 7th. That's a busy 7 weeks for my life every year, okay? That's when you can move around, you can change plans, because I think it's an important time, because as you age, your health conditions change. So what you were very healthy at age 65, at age 70, you may start seeing some changes happening in your age, with your age, or the benefits may change and you may want to see what's out there. I have this said to me all the time, I'm really happy with what I have. Okay. And then I get a phone call later, well, it went away. Well, I offered to review your benefits because there's a change. I think it's so important that you review those benefits every year, even if it's a minor change. And there's so many rules on how to get in touch with regulations that it's hard to reach out. I send out letters. I do all kinds of things for my clients to get them to contact me. Okay. So that goes from October 15th to December 7th. And that's when you can change. For anything that you change at that period will go into effect January 1st. The other open enrollment period is from January 1st to March 31st. That is for people who have Medicare Advantage plans. And they can change one time during that period to a different Medicare Advantage plan. They can go back to original Medicare and pick up a prescription drug plan at that time. Then they have what they call as the lock-in period, which is April 1st through December 31st. And you pretty much need to stay where you're at during that period. But you see in the very last one, it says special enrollment periods for special circumstances. So what are those special circumstances? Well, lately, we see a lot of FEMA coming out with, well, you can sign up people during this period because they were affected. So we see all these hurricanes going on right now. For us in California, we have a lot of fire areas, and we will have a lot of FEMA areas where they will have special election periods where I can change plans. The other one is if you come down with a chronic condition such as diabetes, a heart condition, maybe a mental condition, there's special election periods. Or if you remember earlier, I talked about end-stage renal disease or that ALS, those will qualify special election periods. My other one, which is really, I had a client call me up last week and say, Janice, I'm moving from Orange County to LA County. That opens up a special election period. So those are the different types of special election periods that can be used through the years, and I work with people. The other special election period that I didn't mention is that what if you decide to retire? Okay. And now it's time for you to go on full Medicare. That is going to be a special election period. Any questions? Because you guys had that earlier.
No, I just was asking you, because I'm gonna have you scroll back down, but you already did it automatically because I want to take a quick picture of that. That's helpful.
Yeah, I think we should talk a little bit about the initial enrollment.
Okay.
And one of the things I'm most grateful for is an aunt of ours that recently passed away 20 years ago. Well, not quite 20 years ago, 15 years ago. She explained the importance of signing up for traditional Medicare, A and B, plus a supplement and a Part D plan instead of a Part C plan when you turn 65, because
Okay.
it works out to provide generally better coverage more affordably. And my wife, who was under Part C plans under SSDI, because she had paid in her 40 quarters and was eligible for SSDI, and she was able to get on Medicare for a decade before she turned 65, but she can't get a supplement during that period. On SSDI, you don't qualify for a supplement. You can only do a Part C plan or traditional A and B.
Okay. Real
So
quick.
I think so when she switched to a supplement, when she turned 65, our costs went way down. It's pretty dramatic. So I think it's important for people to understand that at that enrollment time, there is a unique window, because if you sign up for a supplement later,
Okay, I'm going to go
then
over
you're
that.
going to pay a higher premium later.
Yeah, I'm going to go over that pretty soon. Okay, but real quickly, what you were talking about, and then I'm going to tell you about the supplements in a few minutes. Okay. When you are on SSDI or you qualify early, there's certain things that you don't qualify if you're below the age of 65. Once you turn 65 and you have those 40 quarters, then it's going to be different. And again, according to what region you live in, what's more affordable, okay? In some regions, supplements are not as affordable as Medicare Advantage plan. So it just depends upon where you are. I'm not familiar with your area. I have some clients in that area, not exactly where you're at, but the more populated the area is, it seems like the stronger the benefits are and the less expensive it becomes. So if somebody's listening and they live in, I'm going to say Minnesota, okay? That's going to be different than if you're living in Los Angeles, Orange County, because the population is so thick. So it's hard to compare those apples and oranges, if that's understandable. So like I have clients that are on supplement. They think that's where they belong. I have clients that are on Medicare Advantage. That's where they feel where they belong. So it's like, it's a system that has to fit everybody's situation that meets their needs according to financial, location, and health. So I hope I answered a little bit of what you were saying. Okay, here's the supplemental periods that you were talking about. Well, it's part of your question. It has a 6-month window. You turn 65, and they have no underwriting, what they call a guaranteed issue. I love when I sign up people for supplements that they go into this period with the supplement, all right? Because there's absolutely no underwriting with it. It doesn't matter what your health condition is. But a supplement does have a premium that goes with it. And with that premium, it does change on an annual basis. The premium can go up for two reasons, because of age, and it goes up according to what the premiums are. Each state is going to be different, because supplements are managed by the local state insurance boards. So each state, from one state to the other, so the state of Georgia is going to be different from the state of California or New Mexico. The rules are going to be slightly different for each state. Okay. Medical supplement, as I talked about, the guaranteed issue. If you move to a new area, that's where the guaranteed issue is. All plans may not have the same options that are available. Okay. Changing from plans and underwriting, if you're out of that guaranteed issue area, you're going to go through underwriting, and the underwriting for supplemental plans are very strict. Okay. Depending upon what the situations are. So did I answer those questions?
Sort of, but you know, I want to really emphasize something that you implied but didn't quite say, Janice, and that is that if you don't sign up for a supplement when you turn 65, they can charge you a lot more to get a supplement later. Your window to get the supplement affordably and have what could be the best plan for you expires permanently if you don't take advantage when you turn 65. That's really an important message,
okay,
because then you're stuck. You're going to be on a Part C plan to get that kind of coverage. And in most cases, in my experience, it's more expensive on a Part C Advantage plan than on the supplement plan. And so you don't want to miss that window when you turn 65.
right. Again, one of the things that I need to emphasize is supplemental plans have guaranteed issue periods, okay? There's no underwriting. When you turn 65, the cost of the supplemental plan is going to be different than when you turn age 66. It doesn't make a difference if you hit that window or not. Those supplemental plans are always going to go up according to your age. Okay? And those supplemental plan premiums are going to be different according to what letter that you are getting. So like,
right, but you get an underwriting, right? So your medical condition is underwritten if you are not enrolling at your 65th birthday. And
now,
you are not underwritten medically if you enroll in a supplement when you are 65, as you explained. That's why it's important to get it when you turn 65.
it's because of the underwriting. I agree with that. Totally agree with what you just said. It's the underwriting, not the premium, that we want to be concerned about here. It's that underwriting, because chances are if you have certain health conditions, as you get past that window, you're not going to qualify for it, or they're going to charge you more. More likely, you're not going to qualify for it. Am I answering your question now?
Yes, you have finally helped people see that it's important to get it when you turn 65. The window expires after you turn 65 for some people.
And also at birthday months, depending upon the carrier, they may have a guarantee issue at the birthday month period where they don't have to worry about that underwriting. And the word is guaranteed issue that they use in the Medicare world. So you also want to look at that in case you didn't know it. So if you wanted to go from one supplement carrier to another supplement carrier, they possibly will have, depending upon the carrier, again, your state where you live, okay, could have a guaranteed issue period. So those do come up, okay? Now, all of these different plans have star ratings. The carriers have star ratings and their plans have star ratings. Because somebody will say to me on a regular basis, what's the best plan? I cannot tell you what the best plan is. I cannot use those superlatives. I can say, well, the star ratings are. And that's part of my presentation to my clients is, this is the star rating. All right. And I really pay attention to the star ratings, their performance, it says there's 50 key factors. They change on an annual basis. So when you get those questionnaires from your insurance companies, okay, or from the hospitals or medical groups, this is helping them get their star ratings. And I know I don't like filling them out. They take time, but I know what they're trying to do when you get that. That's why they're so important to pay attention to. So if you have something positive to say about them, your medical group, the insurance company, the hospitals, I would fill out those questionnaires because it's very important for them to see those star ratings because it makes a difference to them and how they're rated with the federal government. And you can get information on that just this last beginning of this week. And Devin, you should have received one in your house. You should have gotten your Medicare Renew book that comes out, just one per household. You can find the star ratings for 2023 in there, and for 2024 could be in there, or you can go on medicare.gov and that's found in the back of those books. Okay, so I want to get more questions before I go any further with this.
No, this looks good to me. I don't have anything that came up to me, so this is great.
Did this help you at all, Dean?
Yeah, big time, big time.
Okay. Devin, did I answer all of your questions?
Yeah.
Okay. If you got any more, I would like more questions. Well, great.
Yeah.
Well, this is
You're doing a great job, Janice. You're great.
Okay. Thank you very much. Okay. Now, this is just the end of my presentation that I do when I'm when I'm actually standing up in front of a group of people. I talk about what my services are and what I do. But here on the show, if you want to contact me, I do something that I understand from meeting with some people yesterday. They have been trying to find an agent that will come to their home. I will come to your home and I will visit you and have a one-on-one across that kitchen table. I love doing that because I love that synergy that gets developed between you and the family. You can develop a relationship. I also get to understand what your needs are instead of it just being over the phone. I set up Zoom calls if you live in a different area. I basically represent the state of California. I don't have approved licenses in other states, but if you're willing to have me recommend somebody in your state through my brokerage group, I can find an agent that does the same thing that I do. So this is what I like to review, with you what options you have. You continue with your employer plan if you're still working. I definitely encourage that. Or if you're union, What happens if you're in the military? I have several clients that have VA, or they have something that's called TRICARE, and I do work with them to see if this is a good fit for them. But we go into that. I help people enroll in Part C, known as Medicare Advantage plans, which will include, in most instances, Part D coverage. We enroll people into Medicare supplement and a standalone prescription drug plan. Now, here's a question. Do you guys think that you can have a Medicare supplement and a Medicare Advantage plan at the same time?
I have no idea.
No, Devin's correct. No, you cannot.
Yeah,
Okay.
one or the other.
But I
And
have
so,
a
but
question asked to me all the time.
so can a couple, like the husband have a Medicare Advantage and the wife have a supplemental?
I have that happen all the time.
Mm.
Yes.
You know, the interesting thing I would point out, Janice, from our experience is it sounds so much simpler to have a Part C plan because it's one plan. But the reality is, if you're on an A and a B and a D and a supplement, that sounds like a mess. The reality is, yes, you carry two cards, your Medicare card and your supplement card, but it is easy. And, you know, in our experience, it works a lot better than a Part C plan. So don't be in, I would encourage people not to be intimidated by the apparent complexity because it vanishes quickly, especially with help like you give.
Okay. Again, I'm going to say it depends upon the area where you live and your region. Okay. If I can talk with some of my clients here who all they do is take their Medicare Part C, Medicare Advantage plan. They don't have to worry about anything else. So not everybody's needs are the same. So there are reasons why people pick C, Medicare Advantage over supplement, and what someone's financial situation may be for that supplement versus somebody who wants to pick a Medicare Advantage plan. Again, it's going to be what your needs are. And I would have to know what your area is. I would recommend supplements, especially to people who are not part of medical groups, okay? And they see doctors all over the place, and all of those doctors are taking that supplement. Because but if your doctor is part of a medical group, okay, and medical groups do take supplements, but medical groups usually only refer within those medical groups.
Yeah, so put another way is oftentimes an Advantage plan, a Part C plan will limit you geographically, but when you have Part A and Part B for your primary coverage, that is good anywhere in the United States. So you can travel extensively and never have to worry about being hospitalized while you're traveling. And if for seniors, that's a big deal. But if you're on a supplement plan, or excuse me, an Advantage plan, you may be in New York on vacation from California and not have coverage.
No,
That
that's
can be a
not,
scary thing.
I have to correct you on
Oh,
that.
am I wrong?
You are wrong. You are, I don't want to say, I say your knowledge is not quite right. Okay. I want to be nicer about it. All right. So I want to say that it doesn't matter where you go in the United States with a Medicare Advantage plan or supplemental plan, they have to treat you on an emergency basis. Okay. With a Medicare Advantage plan, you're not going to go and have your regular blood work done, your every 3 months blood work done. But if you need blood work done because you're bleeding out, yes, you're going to be seen. And the Medicare Advantage plan is going to pay for it. just like the supplemental plan. But Medicare Advantage plans will have better coverage, a lot of them, not going to say all of them, again, according to the area and the plan outside of the United States versus the supplement. So if you travel outside the United States, the coverage is usually $40,000 lifetime coverage outside of the United States, depending upon the supplement, the Medicare Advantage plan, and the carrier. So you brought up a good point. If you're traveling anywhere, you need to check and see what your benefits are when you leave your area. I would love to go on with this some more, but I think we really ran out of time. We've gone over time. Thank you guys for being on my show. If anybody has any questions on the Senior Citizens Forum, please contact me. And if you want to get a hold of either one of my guests, I'm going to have their information posted. And definitely watch Devin's show, and see you soon. Thank you.
Thanks,
Bye.
Janice.